We're back, joined now by a healthcare icon, the legendary Sam Ervin. Sam, welcome to our show.
Thank you, Art. It's really a pleasure to be here.
SCAN is the second largest nonprofit healthcare entity in the country and the 15th largest in America. And Sam, you were here at the early stages. You were the founding CEO of SCAN. How does it feel to see how this company has evolved and developed?
Well, it's very gratifying, Art, to see what's continued from the legacy of SCAN. From those first seniors who said we want a better system of healthcare, and to see now that DNA is still very much a part of what SCAN Health Plan is today.
And a lot of people don't know that SCAN was actually founded here in Long Beach. This is an outgrowth of Long Beach people who were dissatisfied with the healthcare seniors were getting, and they banded together, 12 angry men, and
women.
And women, and sought to make a difference, and they have made a difference. And tell us how you first got involved with SCAN.
Well, I'd been deputy director of an area agency on aging that served Ventura, Santa Barbara, and San Luis Obispo counties, and I felt that I saw the plan that SCAN was putting together, and it wasn't even called SCAN in those days. It was really before that name even came into being, but it arose from this study that was done by USC and Cal State Long Beach. Back in the late 70s, 76, 77, funded by the city of Long Beach. So it was really a community effort based in Long Beach. And I was excited about the idea of the plan they wanted to put together to be a more comprehensive approach to linking seniors with all the services that are available, and especially, as Chris said earlier, to help keep people out of nursing homes as long as it's safe and practical and cost-effective.
We take it for granted today, the social HMO, but this was a new concept back then.
It was state-of-the-art. They had studied, this team had studied 40-some programs around the country and come up with an analysis and a recommendation for starting this new agency.
And as Chris mentioned in the first segment, there are benefits, obviously, to the seniors in quality of life, and also a savings to the system cost-wise.
Absolutely, yes. And the savings to individuals, for example, most people spend down once they went into nursing homes. So this system was designed...
Spend down meaning?
Spend down and become poor.
I see.
And then eligible for Medi-Cal, which puts more pressure on the Medicaid or Medi-Cal in the state system. So by helping people to stay at home where they really want to be, and all the research shows that continually, by doing that, you're also reducing and delaying spend down, which keeps people, more capable of covering their own expenses, and puts more money back in their pocket.
Chris, having a legacy from someone like SCAN must be special to you and the folks that work at SCAN today.
Well, it was great. We celebrated our 35th anniversary last September, and we invited Sam. We want to make sure the legacy, and it's not just about Sam, we love Sam, but it's the legacy of Sam and these 12 angry seniors, and the mission and vision that they created. Again, it held true 35 years ago, it's holding true today, and it's going to hold true next 35 years.
And Sam, you and your wife Margaret are members of SCAN.
Yes, Art. We've looked at all the other plans, and we could join any plan we choose, and we choose SCAN Health Plan for all the reasons that we've just talked about. It has that legacy, that rich legacy and experience of serving seniors that I think is unique.
And Chris, I think you told me once that when you become eligible, you will join SCAN.
In 10 years, I'll be joining SCAN as a SCAN member.
Yeah. Where do you see the future going, Sam? You've seen the evolution from the 80s with the social HMOs, and we see the healthcare bill, Obamacare. From your standpoint, where is it all going to go?
Oh, that's a huge question, Art, but I'll just say, relating to the SCAN experience, that I would hope there would be more focus in the future on assisting people with staying at home with all those community-based services that SCAN pioneered, and that there would be more provision for those things and keeping people out of nursing homes when appropriate and when safe and so on, obviously, in the future. I would hope so.
Chris mentioned that one thing Obamacare certainly did was put this issue front and center on the American agenda. And different people have different views of whether it was a good idea or a bad idea, but it's here, and it will evolve over time.
Yes, no doubt about it. I agree, I think, with what Chris said, that I believe it's an attempt to have a better healthcare system, and there are flaws. We can see some of the flaws and some of the issues that are coming up. Let's learn from them and move on.
You must take a sense of real personal satisfaction out of seeing an idea that you helped incubate, and you were there at its genesis, and see how it's developed over the last 20 years or so.
Yes, it's very exciting to see the changes. And Medicare is different today. You know, back when the social HMO started, there was no drug benefit in Medicare. Then that was added, and then it was expanded under Obamacare. So there have been changes in the basis from which health plans like SCAN Health Plan get paid and so on, and in what benefits they provide. And so the benefits today that are available in California, for example, with a health plan like SCAN Health Plan, are terrific.
On the moral issues side of things, a lot of folks feel that as an advanced industrial country that the United States is, that we owe our citizens an obligation to provide a form of health care. Would you share that view?
I believe that health care is something that people absolutely need access to, and that there should be an opportunity for everyone to have some form of health care insurance.
Well, Sam, we thank you so much for joining us, and thank you for the contribution that you made to this very important area of our economy, and obviously your work and the work of SCAN changes lives. So thank you for that.
Well, thank you for having me on, Art.
It's been our pleasure. And we'll continue with this special edition of Straight Talk after these messages. We're back, continuing our conversation with Chris Wing, the president and CEO of SCAN Health Plan. Chris, you've been in this job almost 2 years. How does it feel?
Yeah, it feels great. You know, I don't go to work. I have fun.
Yeah.
It's a great company, a great legacy, as you heard from Sam. Great group of people that share that same passion. So it's very rewarding.
Well, you know, we all just have one time to go through in life, and we have to choose what we're going to do with the limited amount of time God has given us on this good earth. And if you're doing something that you really believe in, that's helping people, you probably sleep better at night.
Actually, this is going to sound trite, but I think at SCAN we are doing just that. We are doing God's work to help seniors manage their health and to stay independent of a nursing home. Yeah. You know?
Bingo.
Bingo.
Yeah.
Can't get much better than that.
Well, we referenced earlier the challenges on healthcare reform, and two of them are lower reimbursement rates and higher compliance standards. How are you addressing those two challenges?
Well, for the first minute we complained, and then we took a look, and I think because we're a not-for-profit, we have a unique opportunity to approach the marketplace. You know, our mission and vision has been consistent for 35 years. Yeah. What other company has had a consistent mission and vision for 35 years and made decisions consistent with that? So the challenge of healthcare reform are pronounced. However, there is so much opportunity to improve service, to improve access, to reduce costs, to have more care delivered in the outpatient side with doctors and through medications rather than going to the ER or going to the hospital or end up in a nursing home. That SCAN is a not-for-profit, trusted by seniors and trusted by the delivery system. We have a unique advantage to approach the system and create new programs to deal with Obamacare.
Let me ask you just a philosophical question. Where do those the moving force for those adjustments come from? Should it come from government regulations coming down, or should it come from providers seeing opportunities and doing it? How is it going to work?
You know, I think needs or necessity breeds all kinds of innovation. And for the last 7 or 8 years, Medicare Advantage plans like SCAN have been getting very robust increases. And when you're getting large increases, you really don't have to focus on being efficient.
Increases in funding.
Increase as far as our revenue rates that we were
Yeah.
getting from the agency that administers Medicare. In 2014, the party's over.
Okay.
And now we have to get more efficient. And the great thing is, the better job we do as far as satisfying members, driving satisfaction,
Yes.
because members don't want to be in an emergency room. They don't want to be in a nursing home. They don't want to be in a hospital. So how can we expand the outpatient side of the equation? And that will drive satisfaction, that drives quality up, and that drives costs down.
And as you mentioned, cost reduction, quality of service, and access, 3 of the watchwords of Obamacare, are founding principles of SCAN.
You know, we're very aligned with the triple aims of healthcare reform: improving access, driving the patient experience, reducing costs, and driving up quality. That's the DNA of SCAN.
Looking back on 2 years, how have things changed? You mentioned times were a little more flush earlier, and that's changing, but anything you want to say about your 2 years at SCAN that reflect on your work?
Well, I think the work of the team, and I'm talking about the 1,200 employees. You know, last year we saw customer satisfaction go through the roof. Our internal satisfaction scores plus what Medicare measured, that's very satisfying to see that type of results. When we take a look at our quality results, the 5-star which Medicare administers for all MAPD plans.
And you're a 4-star, are you not?
Well, we were a 4-star, we dipped down to 3.5, but we're going to be 4-star again next year.
Okay.
To see our underlying quality metrics go through the roof, to see the fact that it was responded, all these good things, there was response in the marketplace. We had been losing market share since, I think, January of 2007. In Southern California, we were 14% market share back then, and each year, every year, we drop a point. And you can't shrink yourself to greatness. But this last year, we brought in a new sales team, and because of our focus on service, because of the products which are really designed to meet the unique needs of seniors who are in different stages of health, our numbers for 2013, we blew through the roof. So it's nice to see the market respond to what the team, is doing internally at SCAN. And
you have, pardon the expression, straight talk meetings with members where you brief them and get input.
We have straight talks with everybody.
We're happy to share the name.
We like the straight talk. I think we got it from you, Art. But we have straight talks with our members in the 4th quarter of each year. We have straight talks with our employees. Every quarter we get all of our employees together in different venues, obviously. We can't fit them all together. And then we're also starting straight talks with, we've had straight talks with providers.
Yes.
And we have straight talks with brokers.
There is always room for straight talk is the moral of that. We'll be back with the rest of our show after these messages. I think Long Beach should be proud of having an entity like SCAN Health Plan within our city, founded by members of the Long Beach community. When you drive on the 405 freeway, you see their signs on those buildings right near the airport, and it's a great addition to our community. Thank you so much, and congratulations again on your 35th anniversary.
Thank you very much, Art.
Okay, thanks for joining us, and thank you at home for being our guest. Please be with us next week for the next edition of Straight Talk. Good night, everyone.
Straight Talk has been brought to you by Southern California Edison, the Press Telegram, and remember, Straight Talk is viewable worldwide 24/7 at straighttalktv.com.